There's something happening in millions of medicine cabinets every single morning. A small pill, usually pink or white, taken without much thought, maybe with a glass of water, maybe alongside a handful of other pills. The routine is so familiar, it barely registers anymore. But after the age of 60, the body receiving that pill is no longer the same body that started taking it. And quietly, without announcing itself, without any dramatic warning, that mismatch can begin to matter in ways that most people are never told about. Losartan is one of the most prescribed blood pressure medications in the world. Tens of millions of people take it every day. Most of them should. Most of them benefit from it. But here's what almost no one explains at the pharmacy counter, and what too few doctors have time to walk through in a 15-minute appointment. The way your body handles losartan at 65 is meaningfully different from the way it handled it at 50. And those differences can stack quietly, building over months or years until a person isn't sure why they feel off, or worse, until something more serious becomes impossible to ignore. What makes this especially dangerous is that losartan works so well. That's not sarcasm. It genuinely does what it's supposed to do. It lowers blood pressure, it protects the kidneys in people with diabetes, it reduces strain on the heart. The problem isn't the drug. The problem is what most people are never told, that as the body changes with age, the gap between this is helping me and this is quietly working against me becomes much narrower. And the signals that something has shifted, they're easy to miss. A little more fatigue than usual, feeling lightheaded when you stand up, a slight change in how you feel after breakfast. Things that could easily be blamed on a poor night's sleep or getting older. But here's the part that matters most. This isn't about fear and it's not about stopping your medication. It's about knowing exactly what to watch for, what questions to ask, and how to stay in front of problems rather than catching up to them. Because informed patients consistently do better. That is not an opinion, it's one of the most consistent findings in medical literature. My name is Dr. Qalb, internal medicine physician and preventive health specialist. This channel exists for one reason: to take complex medical information and make it genuinely useful for the people who need it most. If that's something you want more of, subscribing takes 1 second and it means you won't miss anything. And stay with us through this one because we're going to cover something that millions of people take every single day and almost never question: what losartan actually does differently inside a body that's been alive for 6, 7, 8 decades. Before we get to the specifics, we need to talk about the biology because the list we are about to go through won't make real sense without understanding why the body at 60 or 70 processes medication so differently than it did at 40. Here's the foundation: your kidneys filter everything, every drug, every metabolite, everything your body needs to clear. And here's what most people are never told about kidneys: they lose roughly 1% of their filtering function every year after the age of 30. By the time you're 65, you may have lost a third of the kidney capacity you had in your 30s. This doesn't mean your kidneys are failing, it means they are working with less reserve. A medication dose that was calibrated perfectly at 50 may now stay in your system longer, act more intensely, or accumulate in ways it simply didn't before. At the same time, the cardiovascular system is changing. Blood vessels become less elastic. The nervous system that regulates blood pressure in real time, adjusting it when you stand, when you eat, when you exercise, becomes slightly slower to respond. The heart itself may be working with less margin. And this is where people get misled. They assume that because a medication was right for them before, it must still be right for them now at the same dose in the same context. But the context has changed entirely. The same losartan tablet is entering a completely different internal landscape than it did 10 or 15 years ago. None of what we're about to discuss means you should stop anything on your own. The goal is awareness. The goal is to walk into your next appointment knowing the right questions to ask. Number one, the blood pressure drop that happens after you eat. Losartan's job is to relax and widen blood vessels, which lowers blood pressure. In younger adults with healthy vascular reflexes, the body adjusts constantly and automatically, so blood pressure stays relatively stable throughout the day. But here's what's happening underneath in an older body. After a meal, particularly a large one or one high in refined carbohydrates, blood flow is redirected toward the digestive system. Blood pressure naturally dips. In a younger, more elastic cardiovascular system, this dip is quickly corrected. In an older body that's already on a medication designed to lower blood pressure, that dip has less of a floor. This is where things become less obvious. The result is a condition called postprandial hypotension, low blood pressure after eating, and it is dramatically underdiagnosed in adults over 60. Symptoms include sudden dizziness, a feeling of warmth or flushing, unusual tiredness right after a meal, or that strange lightheaded feeling when you try to stand up after eating. Most people chalk it up to a big meal or an off day. The compounding effect here is real. Losartan extends the duration and depth of blood pressure lowering. When you add that to the post meal dip and to the age related slowing of baroreceptor reflexes, the internal sensors that tell your body to push blood pressure back up, the overlap can produce a meaningful drop right when your body is least equipped to compensate. Falls, particularly right after breakfast, have been directly linked to this mechanism in older adults. This doesn't mean losartan is causing harm. It means the timing, the meal composition, and the dose may all need revisiting. And that brings us to the second one. Because this one involves something your doctor almost certainly hasn't specifically tested for in the last year. Number two, potassium accumulation and why it builds quietly over time. Losartan belongs to a class called ARBS, angiotensin receptor blockers. One of the ways it works is by blocking a hormone system that, among other things, regulates how the kidneys handle potassium. The result? The kidneys retain more potassium than they otherwise would. In most adults at standard doses with healthy kidney function, this is manageable and often even beneficial. Potassium supports heart rhythm and muscle function. But here's what most people are never told. With age-related decline in kidney filtration, and particularly in anyone who also takes a potassium-sparing diuretic, certain blood pressure supplements, or even consumes a diet high in potassium-rich foods like bananas, avocados, or sweet potatoes, that accumulation can cross into dangerous territory slowly and silently. The medical term is hyperkalemia, elevated potassium, and it is one of the more serious and under-recognized risks for older adults on long-term ARB therapy. This is where things become less obvious, because the early symptoms of hyperkalemia are easy to miss or misattribute. Mild muscle weakness, fatigue that feels slightly different than usual fatigue, a faint tingling sensation in the limbs, sometimes no symptoms at all, until a more severe episode triggers a dangerous heart rhythm irregularity. And again, this doesn't happen overnight. It builds slowly, quietly over months, especially if kidney function has been gently declining without anyone running the right lab panel. The reassurance here is simple. A basic metabolic panel catches this, a blood test. The problem is that many people on long term losartan therapy haven't had one in over a year or have never been specifically told what to look for in their results. This doesn't mean losartan is bad. It means there is a specific, easily measurable risk that deserves to be specifically monitored. And that brings us to number three, because this one involves a combination that is extraordinarily common, extraordinarily overlooked, and capable of producing effects that most people attribute to getting old rather than to anything that can actually be addressed. Number three, the interaction with common over the counter pain relievers. This is where people get this wrong more than almost anywhere else. Ibuprofen, naproxen, the NSAIDs, non-steroidal anti-inflammatory drugs that sit on pharmacy shelves with no prescription required, that most adults over 60 reach for at some point for a sore knee, a headache, back pain, or arthritis flares. They are so familiar, so accessible, so embedded in daily life that the idea that they could interact seriously with a blood pressure medication rarely occurs to most people. But here's what's happening underneath. NSAIDs work partly by affecting the kidney's management of blood flow and sodium. Losartan also directly involves the kidney's hormonal regulation. When both are present simultaneously, the kidney is caught in a conflict of competing signals. Blood flow to the kidneys can be reduced. The blood pressure lowering effect of losartan can be partially blocked, meaning your blood pressure rises even though you're taking medication to lower it. And in some cases, particularly in older adults with already reduced kidney reserve, this combination can produce an acute drop in kidney function that, if it happens repeatedly, contributes to long term kidney damage. The compounding effect here is time, not a one time dose of ibuprofen taken once in a year. The problem is the person who reaches for ibuprofen regularly, twice a week, three times a week, because the inflammation in their knee or hip never fully goes away. Not because they aren't careful, not because they ignored warnings, but because no one ever told them that the interaction was specifically meaningful for someone on losartan with age related changes in kidney function. This doesn't mean people in pain have no options. It means the conversation about pain management needs to explicitly include the question of what other medications are involved. There are alternatives, there are safer combinations. And that brings us to number four, which is perhaps the most quietly consequential of all, because it involves something most people assume is always protective. Number four, dehydration and why losartan makes it more consequential than people realize. Everyone knows they should drink water, but here's what most people are never told. Losartan changes the risk profile of dehydration in a specific, measurable way. In a body that is volume depleted, meaning you haven't had enough fluid, blood pressure drops. In a young, healthy body with robust regulatory systems, this drop is quickly and automatically corrected. In an older body on losartan, the medication continues to exert its blood pressure lowering effect even when the body has less blood volume to work with. The result is a deeper, more symptomatic, and in some cases more dangerous blood pressure drop than the same level of dehydration would have caused before losartan. This is where things become less obvious. In older adults, the sensation of thirst diminishes. This is a well documented physiological change that occurs gradually after middle age. You can be meaningfully dehydrated and not feel thirsty. Add to that the fact that summer heat, a stomach illness causing vomiting or diarrhea, or even a hot bath can accelerate fluid loss. And what follows in a person on losartan can be dizziness, extreme fatigue, confusion, fainting, or a fall, all of which in older adults carry risks that extend far beyond the moment itself. And again, this builds quietly. It may be as simple as a hot afternoon, a long errand, less fluid intake than usual, and by evening something feels wrong, and the person can't immediately identify why. The reassurance is this: awareness of this mechanism allows you to manage it. Knowing that losartan narrows your margin during dehydration means you treat fluid intake as part of your medication routine, not separate from it. This doesn't mean you need to carry a 2-liter bottle everywhere. It means this specific medication in this specific body at this specific point in life deserves a specific level of hydration attention. And that brings us to the fifth thing, because this one involves something that happens inside the body entirely invisibly and can unfold over years without a single obvious warning sign. Number five, the kidney function feedback loop no one talks about. Losartan is frequently prescribed specifically to protect kidney function, particularly in people with diabetes or early stage kidney disease. And this is medically accurate. It is a genuine benefit. But here's the nuance that most people are never fully walked through. The very mechanism that makes losartan kidney protective at one stage of kidney function can, at a more advanced stage of decline, produce the opposite effect. Here's what's happening underneath. Losartan dilates the blood vessels that filter blood inside the kidney, the afferent and efferent arterioles. In a person with early diabetic kidney disease, this reduces pressure inside the tiny filtering units and slows damage. But if kidney function has already declined significantly, that same dilation can reduce the pressure the kidney needs to maintain adequate filtration. In a kidney that is already working at a lower baseline, taking away its pressure compensation can reduce GFR, glomerular filtration rate, which is the clinical measure of how well the kidneys are actually filtering. This is where things become less obvious, and this is where the feedback loop matters. If kidney function has been quietly declining over the years since Losartan was first prescribed, the dose that was appropriate 5 years ago may now be working against the very organ it was intended to protect. This doesn't happen in everyone. It isn't common at typical doses in typical populations. But it is specific, it is real, and it is exactly the kind of shift that can be caught early with regular monitoring and missed entirely without it. The GFR number on a standard metabolic panel tells this story. Most people who have it in their lab results have never been told what it means or what number to watch for. That changes today. So, here are a few practical things that actually make a difference. First, ask for a complete metabolic panel that includes kidney function and potassium at your very next appointment, specifically and by name. Don't assume it's being automatically ordered. Ask, can we check my GFR and potassium level today? That single question at that single appointment can catch the two most significant long term risks associated with losartan before they become problems rather than after. Second, track how you feel in the 30 to 60 minutes after breakfast specifically. This is the window where postprandial blood pressure drops are most likely to occur. If you notice consistent lightheadedness, unusual warmth, or fatigue at this specific time, that pattern is meaningful information. Write it down, bring it to your doctor. The timing matters as much as the symptom. Third, treat your hydration as part of your medication routine, not separate from it. A practical approach: before taking losartan in the morning, drink a full glass of water. Not because you need to wash it down, because you're giving your body the fluid baseline it needs for the medication to work in the way it was designed to work. Fourth, and this is the question to ask at your next appointment, word for word: has my losartan dose been reviewed since my kidney function was last checked? Most physicians will appreciate this question. It is specific, it is clinically relevant, and it opens a conversation that should be happening regularly, but often gets postponed in the pace of routine appointments. Watch for subtle signals: a new pattern of feeling off after meals, a change in how your legs feel when you climb stairs, fatigue that feels different from your usual tiredness, or a tingling sensation that wasn't there 6 months ago. The body is not static, it sends information constantly. The goal is to know what you're looking for. If there's one thing to take away from everything we've just covered, it's this: the problem is almost never the medication itself. The problem is the mismatch between a medication calibrated for one body at one point in time and the body that has quietly, steadily, naturally changed since that calibration happened. That mismatch is not a failure, it is biology. And biology can be understood, monitored, and managed when you know what to look for. Let's recap what we've covered. Postprandial hypotension, losartan's blood pressure lowering effect. Helpful in general, but capable of producing dangerous blood pressure drops after meals when aging vascular reflexes are slower to compensate. Potassium accumulation, a natural consequence of how ARBs work, protective in most contexts, but capable of building quietly over time into dangerous levels in aging kidneys not being monitored closely enough. NSAID interactions. Ibuprofen and naproxen are extraordinarily common, deeply familiar, and capable of both blocking losartan's effects and stressing the kidneys when both are present regularly. Dehydration sensitivity, a narrowed margin that comes from the combination of losartan's mechanism and the physiological decline of thirst sensation that quietly comes with age. And the kidney function feedback loop, the very protection losartan offers in early kidney disease, can shift at a more advanced stage of decline in a direction that requires monitoring and potentially a conversation about dose. Awareness leads to better questions, and better questions lead to better decisions. If this helped clarify something you've been carrying around as a vague concern, or gave you a specific question to bring to your doctor, then this video did exactly what it was here to do. Subscribing keeps this kind of information coming to you. No noise, no alarm, just clarity. And if you know someone who takes Losartan every day and has never had this conversation, sharing this with them could genuinely matter. A single conversation, started by a video like this, has changed outcomes for real people. The last thing to leave you with is this: your relationship with your medication doesn't have to be passive. You don't have to simply take the pill and trust that everything downstream is being managed. The most effective patients are not the most compliant ones, they are the most informed ones.